For the second day in a row, New York City had the worst air quality in the world among major cities, with much of the eastern U.S. blanketed with this smoke from raging wildfires in Canada. Emily Akeda has more of the dramatic scenes across the East Coast.
Tonight, cityscapes unrecognizable in much of the country. An eerie glow disguising Manhattan, the Washington Monument practically hidden, and a haze over Detroit. The smoke today clouding skies so much the FAA issued a ground stop, temporarily pausing all flights into LaGuardia and slowing air travel into Newark and Philadelphia. From the Midwest to the Northeast and down the East Coast, 90 million Americans are under air quality alerts from wildfire smoke. The dangerous plumes are funneling into 16 states from fires in Canada, where more than 400 are burning. 239 of them remain out of control. The U.S. with help on the ground.
We have already deployed over 600 U.S. firefighters and personnel, as well as equipment like water bombers to help Canada battle the fires.
For the second day in a row, New York City recorded the worst air quality in the world among major cities. Its air quality index, or AQI, today reaching hazardous levels and nearly doubling that of Delhi, India. Any AQI above 150 is considered unhealthy. Higher than 300 is hazardous. New York City today hit 342. The city's iconic skyline today transformed into frightening shades of color. Major League Baseball and the WNBA postponing games in Philly and New York as New York City and Buffalo Public Schools canceled all outdoor activities. The state's governor calling the air quality an emergency situation.
And the bottom line is this: if you can stay indoors, stay indoors. This is detrimental to people's health.
I want to bring in Dr. Vin Gupta. He's a critical care pulmonologist in Seattle and a professor at the University of Washington. Vin, last night you tweeted, "Protect your lungs." So I invited you on tonight to explain, how do we do that?
Well, Stephanie, thank you for inviting me on and for platforming this issue. It's the important question of our time because pulmonary insults, lung insults to our health, whether it's a pandemic or whether it's a wildfire, this is the reality that all of us live in. Let's talk first. Let's just define the problem here. Air pollution. It's now the 6th leading cause of death, Stephanie, across the globe. It was outside the top 10 just 20 years ago. So this is something that we need to think about. That breathing in terrible air because of wildfires largely across the world is causing people to die, causing ill health. It's causing in utero complications, preterm birth in some cases. If you're an expectant mom in New York City, as an example, this is relevant to you. It's not just hazy skies here that look off color. This is something that is relevant to all of us, not just those of us with asthma. Immune system complications for children. This is something that we know is correlated with just even a few days of exposure to wildfire smoke, Stephanie. So this is something that impacts us all. We see this all the time on the West Coast. To your point, what can we do to keep ourselves safe? First of all, across the country, because this future that we live in here is going to be focused on lung health. Lung health is pulmonary health, or is public health rather. Check your air quality, especially during the summer months here, airnow.gov. Know if you're living in a place where air quality is an issue, where you may have sensitivity, especially if you have a child that's asthmatic, if you yourself have underlying lung or heart conditions. Avoid, if you're in New York City right now, Philadelphia, across the eastern seaboard, do not go outside and exercise. Critical. I've heard so many of my colleagues and friends on the East Coast say they went for a morning run, it felt okay. That's not the thing to do tomorrow morning, Stephanie. So critical to avoid that. What can you do to keep your indoor home safe? If you have AC, put it, turn on the AC, make sure you're not recirculating air, make sure that you're closing the fresh air intake. But that AC has a filter in place that if you've replaced recently, hopefully you have, will keep your indoor air quality safe. If you don't have AC, you can get a HEPA filter. Stephanie, HEPA filters are about $100 a pop. That's expensive for a lot of folks. Mm-hmm. If you can't afford that, if you don't have that, box fans, about 10 to 20 bucks based on where you're purchasing it, plus a MERV, M-E-R-V 13 filter. You can buy that in total for about $30. That can keep your bedroom safe. That's critical to place that MERV 13 filter with a box fan in the bedroom, places where you're going to spend the most amount of time.
If this polluted air is impacting us, what symptoms should people be watching for, right? Lots of people are going, oh, I got a sore throat, I have a cold. But what could be coming from the air that we should be noting?
Most the way you have sensitivity is exactly as you said: scratchy throat, burning eyes. Is that going to go away with time? Yes, it's going to go away with time. It's probably not going to result in anything that's going to be of long-term consequence. What's more concerning is going to be chest pain. It's going to be shortness of breath. And that's not just those with underlying asthma or heart failure or those that, say, have underlying heart disease more broadly. That can happen even to those that seemingly are healthy. So it's important to keep in mind, are you having chest pain? Are you having shortness of breath that's new, unusual for you? Because, Stephanie, here's the key piece. N95s are useful, important to keep that in mind. N95s that we talked all the time about during the pandemic, at the height of it, useful here, but they're not fully protective. Surgical masks, cloth masks, not useful at all because the fine particles that are emitted from a wildfire are frankly moved through surgical masks very easily. N95s are somewhat helpful, but those fine particles are so small. What they do is they lodge into our lungs, into the smallest crevices of our lungs, our air sacs. They lodge into the arteries surrounding our heart, and they cause inflammation. That causes these problems like shortness of breath, potentially chest pain. So those are really the red flag symptoms to look out for.
So just really quickly before we go, N95, if we're leaving the house to go to work, to go to the store, we do want to wear an N95 or we don't?
You absolutely do. Even a few minutes of exposure can be detrimental.
All right, Dr. Vin Gupta, thank you so much for joining us tonight. I saw that tweet and I said, we got to get the doctor here. You definitely helped us. Good to see you.